Well, hi everyone. This is Dr. Schroeder with this week's video wrap-up of week number 4 and introduction to week number 5. Week number 4, we have been discussing this article, the Aiken et al. Article on hospital nurse staffing and patient mortality, nurse burnout, and job satisfaction, which of course is a quantitative study and is really, compared to the studies that we've been looking at, is just kind of a humongous kind of a study with a lot of data and a lot of different variables that were looked at. Very much in contrast to for example, the Kokava study, that hand massage study, that was very straightforward. These are both they're both quantitative studies, but each with a different purpose, each with a different problem that they're trying to solve, and each with a completely different methodology. Going back to the Kokava study that we had looked at in earlier weeks, it's a very small study, very small, essentially one independent variable, which was hand massage, one dependent variable, which was levels of comfort in a relatively limited population of patients and with a relatively limited study sample. And so it was very straightforward, just seeing as there's this cause and effect. Does hand massage cause increased comfort in these patients? Very small, very simple. Where this quantitative study, this Aiken study, is very large. 25% of all the nurses in the state of Pennsylvania were surveyed and queried in a quantitative fashion about job burnout and job satisfaction. And virtually every hospital, except for certain subsegments of the hospitals in the state, were reviewed to look at patient data. This is what's known as a cross-sectional study. Cross-sectional in cross-section was done in this particular case because they wanted to limit the amount of data. They were trying to limit the amount of data to a particular time frame because they wanted to make sure that the data that they're looking at on the patient care side was consistent with and coming in essentially the same time as the data that they were getting, this patient satisfaction data from the nurses, or excuse me, the nurse satisfaction data from the nurses. They want to make sure that all the data was coming from a specific time frame, and that makes it a very tight study. And of course, the discussion this week was really to talk about, was this an appropriate design, which it really was, because that given the amount of data and given what they were looking at, that probably was the best sort of design that they can use. A lot of you had pointed out that if they had limited the data, that there was just so much to look at, and that they had looked at so many different things, and so essentially, kind of paraphrasing the class, where do you go with all this data? What does it really mean? Um, and I think the best analogy I can use, the reason that the researchers decided to use this, and again, this study was done in 2002, done on the heels of the uh, California patient ratio laws that had been passed just a few years prior. And essentially, they were saying in Pennsylvania, this is the same data that came out of California. Is it the same here? Or are we going to come up with different sets of data? So when you ask a question like that, it's like, what are the state of things? The analogy that I would use is kind of like to say, okay, somebody wants to look at their finances. Somebody is saying, I want to look at my entire financial picture. I'm getting the feeling that I'm not making as much money as I used to, and that I got a lot more outgo. I don't have as much money in savings, but I really don't know why. So it's like, okay, well, let's look at everything. We're going to look at all the income statements and all the sources of income. And then we're going to look at all of our bills and all of the credit card statements. And we're going to look at all the taxes that we pay. How much do we pay in groceries? We're going to look at all this data, and we're going to look at it for what's happened in the last month. So we're going to limit it. So again, just to kind of get sort of a snapshot of where things are at. And that's really kind of what this study is all about. So it's an appropriate design, but those of you that pointed out that it doesn't really mean much, you're absolutely right, because it is a cross-sectional design, it is limited. There's not a lot you can do with the data, because really the whole point of the data is to say, what do we know? What would the next logical steps be? And so and many of you had pointed out that doing a longitudinal study, looking at a narrower set of these particular values that were looked at, patient mortality and staff burnout and nurse staffing, these can be maybe looked at and focused on a little bit more and looked upon over a longer period of time to see if there's any trending, or to see if we can see if there's more of a cause-effect relationship. And that's exactly right. That would be the next logical step. Doesn't mean this is a poor study. It just means the purpose of the study was to look at the problem from a very large perspective, the entire state of Pennsylvania, trying to get as many nurses as possible, looking at as much patient data as they could. And they controlled for that data to make sure that it was not going to be skewed by eliminating any hospitals where they could not get valid data, that did not have the same kind of data as the other hospitals. Essentially, all the federal hospitals were kept out of the study. They focused on just the private hospitals and the state and county hospitals that would give them like data that they could go ahead and look at. So again, it was a very it was a very interesting study. And of course, also another side discussion always comes up talking about just staffing in general, and the idea that it is kind of interesting. And I personally practice in California primarily. California is the only state so far that does have a nurse-patient staff ratio law. In California, for med-surg, it's 5-to-1. In certain special areas, it's as low as 2-to-1 or 3-to-1. In mental health, it's 6-to-1. So these are numbers that the state came up with, quite frankly, arbitrarily. I was on some of the task force that was developed when we were actually coming up with this uh, nurse-patient ratio law. And the numbers that were originally brought up were actually really quite arbitrary. And the state is always going back and trying to find new data to try to revalidate these numbers and to say what really is the best numbers to go with. But that's kind of sort of like a side conversation. And so very good, very nice discussion. This week, in week number 5, we're going to be looking at the same article, the same study, and we're going to start looking at the sampling plan and the way that the researchers gathered their sample, and talk about the difference between a sample and a population. So I'll leave you to your reading, and I'll leave you to digest that and discuss that. And once again, I'll be participating in class right along with you. You have one other assignment this week, and that is the first of your critiques. You have a quantitative critique. You'll see that there is a form to download. This is not a paper you write. There's an actual form, a template that you download, and you just type straight into the template. You don't have to worry about formatting a paper or anything like that. Essentially, you're going to be writing your responses into a template. There is an assigned article. You'll see that article in the syllabus, and it is listed. So in other words, you're not going to be finding your own article. You're going to be using the assigned article for this particular assignment. So you want to go ahead and make sure that you're grabbing the right article, download that, and then there will be a total of 24 different question boxes that you're going to be answering. Please also, there is a rubric for this particular assignment, so review the rubric as well. Essentially, for each one of those boxes that you're going to be completing, the thing to remember is that you have to document, for example, one of the questions is going to be asking about the research question. Was there a research question? Was it significance to nursing? You should indicate, yes, it was, and actually evidence that. Where did you see? What did you read? What was it in the article that led you to that conclusion? In other words, these isn't just yes and no answers. You need to actually evidence where in the article was each one of these critique points found. It does take a little bit longer than it may look at first glance. At first glance, it looks like it's a pretty easy assignment. It actually is fairly time consuming, so make sure you leave yourself plenty of time. Those will be due by Saturday night at midnight. I'm recording this on Sunday afternoon, so this is Sunday of week 4. Tonight is due your midterm exam. Most of you completed that. When I checked earlier this afternoon, I think 2 still were left to be done. And so, but overall, the scores are looking pretty good. It looks like that's going to be pretty. The results for that are pretty valid. Looks like the median score is coming right in around 88, 89%, something like that, which is pretty good for this particular test. So well done. Everybody's doing really good. So as you have any questions, please let me know. But the main thing is going to be the discussion question and then that quantitative critique. And look for your grading to be completed by the weekend for your discussion questions this week. So everybody have a great week. I look forward to participating with you once again in class, and we'll see you in the discussion forums.